So, okay. So, I use this quite a lot, and it's extremely good for people who have got a lot of neck and shoulder pain.
Yes.
It's also good as well for specifically working the individual areas of the neck muscles that come into the top traps. And it's also excellent as well for tiny little trigger points that can appear here on the side of the neck and also in this crevice area here, and that also may sit on top. When you have your client, you can have them sitting in the chair, or you can have them sitting off the edge of the bed. But if they're sitting off the edge of the bed, they don't have any back support. So
Yes.
for lower back problems, and if it's going to take a bit of time, you're actually better off putting them in a chair, okay? We can move Molly later on when we come more into stripping into the erector spinae. We can move her on to the bed then, okay? Now, this is such a simple technique, but it's extremely efficient.
Yes.
So we're going to, with more sports massage, you use waxes and creams because it's very slow and controlled, and there's a lot of repetition, okay? So we've got a little bit of wax here that's got some nice arnica in it.
Okay. You just buy it in the store?
Yeah, you just buy any of them in the store.
Okay.
And probably in the herbalariums, okay, or you can get them in the chemist. So you just want to take a little bit of wax,
Yeah.
and you just want to put it on the area that you're going to be focusing on. Again, if you use like almond oil or especially the aloe vera oil, it's way too thin, it's way too slippy, and you
Slippy,
cannot
yes.
get you can't get a grip of what's going on. So it's super slow and it's very focused. Okay. So we're going to be looking at, let's say, band 1, band 2, band 3. So we're going to be tracking these 3 areas here. So what we want you to do, Molly, is this is your head, right? I want you to turn your head to the side really slowly and then look down. So for the outer part here, okay, of the neck, come back. Okay. All right, super slow. So I've got a reinforced finger here. You track down and then down. Move the head down. Okay. And come back. Okay. So even slower this time. Here we go. Okay, to the side and down. Okay. So when she stops, you stop. Right? Come back. Okay, to the side. Okay, she's really tight there. And down. So when you're tracking with your power finger, you're picking up the information of where it's tight. Now that actually feels quite nice, but when you come to here, I'm getting the information of it's tight. There's no knots, there's no trigger points, the whole thing just basically holds there. So what you want to do is to keep repeating it until it loosens. So let's come back again. Okay, to the side. And down. Very nice.
You don't put a lot of pressure there, right? Or you do?
Yeah, we'll come to that in a minute. Yeah. So you can do one sweep for one movement if it's in a good state of looseness. You'll find that if it's really tight, it can take you once, twice, 3 full movements of the head in order to strip that part of the muscle. Okay, so let's just do that again. Okay, to the side and down. Okay, it's beginning to loosen now. Okay, come back again and to the side and down. Very nice. Okay, so that was say band 3. I'm going to come slightly back now into band 2. So I'm sit and see slightly just behind that area. Okay, to the side. Okay, straight away that's tighter than the
Yes.
other one. Okay, and down. Come back and again. Very good. Okay, really slow. Okay, come back and again. And down. Okay, and come back. Right, so band 2 that sits slightly in the middle there, that is in a much more state of tension than here. So that's that muscle there, that's called the sternocleidomastoid muscle. It's the SCM for short. And behind here we've got more of the traps happening in the scalene muscles which
Scalene, yes.
sit round at the front there. Okay. So these ones in here, as you just move a finger, the tension can change so dramatically. So I would say there, the first one we started on was maybe we talked briefly about pressure levels of 1 to 10 last week, with 1 being very gentle and 10 being extremely painful. When I'm working with that, I would have given it about a 2, 3.
Okay.
So again, anything that's soft, you don't want to pay too much attention to. We also know that if it's nice and soft and loose, as a muscle therapist, we don't need to continue to work with that. However, I move one finger in, we're going to be moving towards the cervical spine there, and straight away, I'm right up now. That's about a 7, 8, okay? So you can move that much, and it can go from a complete state of looseness to being, okay, we really need to work, right? So if this is about a 7, 8, again, what we want to be doing is repeating our techniques, but just taking it really slowly. So I am working at a 20% effort.
Okay.
With soft tissue release, it's at a 20% effort. It's not really...
It's not
it's not like
there.
deep tissue where you're trying to go in as far as you can.
Yeah.
And we'll be taking 3 swoops. Okay, Molly, to the side, please. And down. And come back. And to the side. And down. Very nice. And come back. To the side. It's beginning to soften. And down.
Is it painful, Molly?
No.
Okay.
Okay, now there she's super tight.
Yeah.
Right, so the neck is releasing quite nicely with the repetition of the movement, the application of technique, but this is really quite tight. So the next strip I come back, I'm going to be focusing here. Okay, now what I want you to do now, Molly, is to actually tilt your head down and then to the side.
Okay.
Very good. Okay, and come back. So if I change the movement of the head because it's sitting here, that is not going to stretch the muscle tissue out. You
Yes.
see, because it's here, what we actually want to do, because the muscles attach into the occipital ridge in there, so if she actually moves the head down, it's going to pull the muscle tissue up, okay? As you're sweeping in the other direction at a 20% effort, it's going to create more traction
Yes.
with the wax, so you've got a better chance of loosening it. So you can adjust what you're doing slightly.
Okay.
So again, this is quite loose now, so I'm going to stop here just above where the problem area is. Okay, just go down for me, please. Very nice, and to the side. So see how slow I'm going?
Yes.
Okay, and come back. So I moved about that much in one sweep, okay? So if you want to get more focused, you yourself have to go really slow, still at a 20% effort. Okay, go down for me, please. Very nice, and to the side. Good, come back. Okay, now I want you to take it to the side and down. So you see how we changed the movement technique
Yes.
again to focus on there, because obviously if she pulls to the side, it's going to move the muscle tissue this way. Okay, so you can combine what you're doing.
Would you also do this movement? Yeah, you can do.
Yeah.
Okay.
That's a deeper movement.
Yes.
So you want to heat the area up first.
So first
okay.
easier. Yes.
And then we want to do our trigger point compression work, and then afterwards you would see if it loosens. So that's much more advanced work. Well done.
Okay.
Did you have somebody do that with you?
Yeah, but I would just think like if you do this,
Yes.
it's so much more intense.
Yeah.
So I was wondering if that's okay
Yeah,
to do.
that comes at the very end. Okay.
Yeah.
All right. So again, I'm coming back here to my problem area. Okay, sweet. Go down for me, please, Molly. Thank you. Beautiful. And to the side. Very nice. Okay, so that feels softer this time. Come back for me, please. Okay, and straight down. And to the side. Very nice. And come back. Okay, this time to the side and then down. And come back, okay? And again, you're going down. Very slow, 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 slow. Good, and to the side. And again, okay? Yeah, go down. And to the side. Come back. Okay, Okay, this time to the side and then down. Very nice. And relax. Okay. So this is what's called active movements, where
Yes.
I'm actively getting the client involved, okay? So they're in control of what's actually happening with the head movement as I apply the technique. Now, as you continue to work, you need to guide your client with it. It's beginning to soften there on band 2, but instead of her being in charge of the movement, it actually at this stage is much better if you passively work, right? So passively means that I'm going to move her head. And the reason why this is good is if she gives me control of the head, I can be much more specific here on the area because I'm in control of what's going on. So if you remember it this way, active movements is actively when the client is in charge, okay? Passive, she's going to pass control on to me.
Yes.
So that's how you remember it. Right, Molly, just you relax, I'm going to do this, okay? Very good. Does that feel different for you, Molly? Yeah.
It's
What-
more intense, right?
Yeah.
Because she's not using her muscles to do it. You're doing it
That's
for
it.
her.
Yeah.
Yeah.
So the muscles are actually more relaxed
Yes.
when you work passively. As a therapist, I tend to be much more of a passive worker.
Yeah.
Yep.
That's what I wanted to ask. Like, can you go directly to the passive?
Yeah. If you're a
Yeah.
passive worker, then
Because
do
you
it.
just have the control, and
Yeah,
it's like,
yeah.
yeah.
When I work with the head in this way, though, especially if there's lots going on here, actively I'll get them to do it. So in the beginning, I'm assessing what's happening exactly.
Yeah.
Where is it? Once I know exactly, okay, it's there, there, and there, then passively,
Then you
I'll
do.
get involved with it.
Yeah.
Okay. Okay, so down. And then to the side. Okay, now what we can also do is some trigger point work as well, which is slightly different from the movement of the head to the side. So the trigger point work is as you come down, you find the trigger, which is there, or the area that's hypertonic. You can hold it for 10 seconds. Breathe, Molly. Okay, so you just want to apply pressure onto that area that's holding. So that would be 5, 4, 3, 2, 1. And then continue with your movement. There's another one there. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And down. And all I'm using is a power finger.
Yeah.
Okay? There's another one. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And just relax.
So when you do the trigger point, you stop the movement,
Yes.
and then you keep going, and then you stop again.
That's
Yeah,
it.
okay.
Yeah? Now, each individual one, it's for 10 seconds.
Okay.
As the areas that are really tight, or the trigger points, as they release, remember when we're working in this way, the blood system will flush into these areas that have been holding really tight, and it brings new blood into the area, which also brings oxygen into the area too.
Yes.
You're really close to the brain.
Yes.
So what happens is the oxygen also moves around the brain as well.
Okay.
So you'll find that afterwards your clients will say to you, I feel so relaxed.
Ah, yeah.
That was just like so relaxing, and
Okay.
it feels very nice for them to receive,
Yeah.
but also the way that the oxygen goes into the brain after the treatment is it really changes them for the rest of the day.
Okay.
Okay. So you just keep holding it. Now so I had 3 points there where I worked for 10 seconds. I need to know where they are. So I've got my imaginary map. It was here, here, and here.
Yeah.
I'm going to go back in and strip it again. And when you're working on these points of tension, it's 3 times on each specific one.
Okay.
Okay, as a general guide for trigger point work with soft tissue release, it's 3 times, and then you would pull it back, give it some love. So the pull it back, giving some love, is actually stripping.
Stripping, yeah.
It's just stripping. Okay?
Also with the movement.
Yes.
Okay.
Okay. And then I'm coming here now into band 1, which sits next to the C-spine. So for band 1, what we want to do here is really just take the head down. Now I call this the nodding dog.
Yeah.
So we've got different ones. I don't know what, to the side and down. Just tell them what to do. This one for nodding dog, it's easy to remember because you're straight down. We
Okay.
also come into the slouch as well later on.
Yes.
Okay, so we're here. So you just want to take her into nodding dog.
And did you call band 1 again because you start, or no?
Do I what, sorry?
How do you call this area?
Next to the C-spine, I call
Yes.
that band 1.
Okay.
So you need to know things like this as well. So like when we went through our contraindications last week, remember
Yes.
for any damage in the spine,
Yeah.
herniated discs, prolapsed
Yes.
discs, slips discs, dehydrated discs, you wouldn't be working in at band 1
No.
because they're friends with the bones people.
Yes.
So it's way too close.
Yes.
But if somebody had pain here, there's no problem at all.
That's okay.
If you want to work band 2, band 3, because we're only working at a 20%
Oh yeah.
pressure
exactly.
level.
Yes.
So all it's actually going to do is free up the muscle tissue, which perhaps could
Will
help
help.
with the nerve reacting. Okay,
Yeah.
but perfectly safe. So that's important.
Yes.
Okay.
Okay.
So the lovely news for her is that she's got beautiful muscle tone. You can tell that she really does do her sports and she does her stretches well too.
Yes.
Because I'm not really picking up so many trigger points here at all. That she's just a little bit tight there, but that's to do with the activity.
Yes.
So let's just come in at band 1 again. Here I'm on my power finger and I'm just going to take her down. Okay, so any points of tension, it was slightly tight there, so I'm just going to hold her for 10 seconds. And again, you can work actively if you prefer. And on we go, Molly. There's another one. Do you feel it slightly changing difference? Yeah, so she can feel it.
Yeah.
It's probably going between a 3 and a 4.
Yeah.
Okay, it's hardly anything at all. And continue down.
Also the the passive movements.
Very
It's
nice. Then come back.
it's nicer experience for the clients.
Yes.
No? Then they have to move all the time and like.
Yes, yeah. So after you work band 1, band 2, band 3, so we've got our power finger stripping each one,
Yes.
okay? We can work actively, passively. We can also put a power finger on points of tension, not trigger points for 10 seconds with no movement. After the 10 seconds, you then move and the head and you also strip at the same time, okay? And then we can actually do a kind of effleurage. So take the side of your finger and use the whole side of your finger to cover band 1, band 2, band 3. So we're just coming round.
So that's everything. Yeah.
Yeah,
It's like a forearm but with a finger.
exactly. Yeah, so it's a bit of a steamroller effect. So you want to just
Yes.
smooth the whole thing down. That's it. Thank you, Molly. I'll just get Molly to do that actively. That feels better for me.
Yeah.
And down. So that feels quite nice. It's still holding in here, right? So now we're going to come in with our deeper movements. So what you want to do is to get the client to move their head first, right?
Yeah.
As she moves into the muscle will soften.
Yes.
You then want to come in with a power finger, reinforce it. Now, super slow, Molly. Lift your head up and just face directly. Okay, do you have any pain? No. Okay, then move your head over to the window. Okay, stop. No. Right, so you're there. That's it, yes, it's just a tilt. So let's call this the tilt.
Yes.
Okay, so it's there, right? Can you feel it pulling now? Yeah, so I can really feel it changing as she goes into extension there. So just stay there. And then you would take it for 10 seconds again. 3, 2, 1, stay there. And then when you're ready, just extend the head even more. And you feel what's called there, it's there. You feel what's called a bind. That's a point of resistance where you feel it catching, okay? Okay, and then again you want to hold that for another 10 seconds there. And relax, bring your head back up now and effleurage it down. Okay, so bring your head in again, come on to, let's say, band 2. You can even move your finger.
Yeah.
It's absolutely fine. It's called tracking. To kind of move it and go, right, where are you? Right,
Yes.
there, I've got you, okay? Right, super slowly, Molly, let your head just come up. Okay, stop. Do you feel any tension? No. Okay, right, just hold that. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Now very slowly tilt your head over to the window. And stop. You feel it there? Okay. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay, tilt again. Okay, and it's released. And come back. Okay? And just effleurage it back
So
down
why
again.
do you do the last one a little bit further?
Yes, it's if she can actually take it over. So her mobility's pretty good. She's not got that much going on. So see the way she can take it right over.
Yeah.
If somebody is really tight or they've got a lot of trigger points there, basically all that will happen is you may even get the head to here.
Yes.
And because it's so sore, they can't actually tilt their head over, right? But because she's in a good state of looseness, she can actually take it right over.
Yes.
So if they're here and they're like, oh my god, that's so painful, all you would do is hold it for a 10, take the head back in, reapply, and just slowly keep working till it comes up.
Okay.
All right?
Yes.
So remember, if in doubt, always back off and go easy.
Yes.
All right? So what we'll do now is we'll work with her on a scale of 10 to help you kind of understand a little bit more. So turn your head in. I'm coming in more to band 1 area here. Okay, I've reinforced my power finger. Right, up you go now. That's it. Okay, and stop. Right, Molly, on a scale of 1 to 10, with 1 feeling very gentle and 10 feeling extremely painful, where are you?
3.
Okay, now remember, anything that's a 3 and below, you don't want to waste your time with. Anything above a 3, we want to treat. So
Yes.
she's okay?
Yes.
All right, very slowly tilt your head to the side. Feel the bind, stop. Okay, scale of 10 now, where are you? She's still a 3, no problem. Deep breath. Okay, tilt your head further to the side. Right, where are you now?
4, 5.
Okay, she's a 4, 5. All right, I want you to focus on that breathing. In through the nose, big sighs, out through the mouth. As you breathe and as I press, you will feel the muscle release. It'll go 5, 4, 3, 2, 1. When you're at a 1, which is a complete state of looseness, all you feel is pressure and no pain, just say 1. Let me know that you're there.
1.
Very nice. And I'm just going to strip that down, effleurage it, and bring it back. Okay. So I'm just giving it a bit of effleurage.
Yes.
Okay, a little bit of digital finger work there. So I'm going back in now and checking how does that feel.
Yeah.
So you just want to come back in now with your full sweeps, and what we're looking for is a change in the muscle tissue.
Yes.
Okay. All right, Molly, take it to the side, please, and down. Beautiful. Very nice. Okay, slightly here. You feel that? Yeah, slightly there. So that's much better. Okay, into band 2. On you go to the side, and then down. Very nice. And into band 1 to the side. Sorry, come
And
back.
3.
Down. Yeah, nodding dog. So she was in quite good shape to begin with. Very, very slightly it's holding in there, okay? The fact you can get her over in a tilt as well, it takes her to go to the last one. She's up at number 5. She's in a great state of looseness. Okay, you're going to give that a go and you're going to do this side now,
Yes.
okay?